Hi, my name is Kevin Kirk. I'm an orthopedic surgeon here at the San Antonio Orthopedic Group. I specialize in disorders of the lower extremity and the foot and ankle. Oftentimes patients sprain or strain their ankle and have some swelling or some support issues in which they often want to wrap their ankle. And so what we're going to demonstrate today is how the proper way to wrap your ankle. Ace wraps you can buy at the store come in all different sizes. This goes from 1 inch to 6 inch, but the typical person would usually require a 4-inch ace wrap, which is this one right here. And with the help of my certified medical assistant Deidre, we're going to show you how the proper way to wrap your foot and ankle. You start here at the base of the toes, and you do one small wrap around, and you want this to be relatively snug, but not so tight that it's going to cut off your circulation. And then you wrap it up, and this is called a figure of 8 wrap. And you wrap it around your ankle like this and back down, and then you just continue to repeat that sequence of a figure of 8 wrap. And what you can find is you can pull the ace wrap a little bit more snug to not only give you support, and you can support it either from the outside or the inside, whichever one that you feel that you need it the most, or to give it a little bit extra compression. And these newer ace wraps have the Velcro already in there, and you can see is that you have this nice figure of 8 configuration with the ace wrap. This is good for support of your ankle as well as to control the swelling. However, if you continue to have symptoms after 5 to 7 days, it may be a sign of something more serious and you may want to consult a doctor.